Hi everyone, I'm Sarah. Growing up, I was never sure what I really wanted to do with my life. I thought about being a teacher, a veterinarian, or orthodontist, but I ended up going into nursing. Throughout high school and college, I did work at a water park and I babysat a lot, so I love kids, so being a pediatric nurse was a very easy decision for me. Not everyone knows what being a nurse entails, and the way that the media portrays nurses is not acceptable. So I'd like to go ahead and tell you a little bit about being a pediatric nurse, the role of actually being a nurse, the education requirements, and the emotional requirements to be a nurse. So first off, I'm going to start with the role of being a nurse. Not just with pediatric nursing, but with all nursing, we have to do assessments and charting on all of our patients. At my hospital, I can have up to 6 patients maximum at one time. So I have to chart on all those kids. And the rule is if you don't chart it, it hasn't been done. So charting is very important. With our assessments, we do head-to-toe assessments to make sure that we go in an organized manner. It's important so that we know what the baseline is of our patient to see if there's any change from the previous shift and if there's any change throughout our shift. And we do use stethoscopes. It's not just an accessory. We do use them to listen to lung sounds, heart sounds, and bowel sounds. We do administer medications. It's a very important part of our job. There are multiple rights to medication administration. You have to make sure it's the right patient, the right medication, the right dose, route, and time, that you document correctly on the medication. It's given for the correct reason, and the patient has the correct response to the medication. Let's see. Knowing normal and abnormal vital signs and conditions is also a very important part of nursing. And you also need to know the treatment for the different situations. I'll give you an example. This was actually a few months ago. I had a baby that came in with bronchiolitis. He was on oxygen, and all throughout the day and through my shift, he was just nonstop coughing. I ended up calling the physician. We changed his oxygen route of administration multiple times, and he ended up having to be sent to the PICU. He was actually in the PICU for a week on high-flow oxygen in order to stabilize his condition. That would be examples of when to notify the physician, knowing how to treat different conditions, and notifying the physician is a very big part of our job too. I work night shift, so it's a little intimidating having to wake the doctors up, but it's part of our job. Now that you know the roles of a nurse, I'd like to go into more detail about the education requirements. I did do 2 years of prereqs and then my 2 years of nursing school. So I have my associate's in science degree, and I'm going back for my bachelor's. After you complete your nursing school, you take the NCLEX in order to get your nursing license. And then there's different certifications that you need afterwards, such as your BLS, which is your basic life support, which involves chest compressions. ACLS, which is your advanced cardiovascular life support, which involves the chest compressions and medication administration. And then I have PALS, which is pediatric advanced life support, which involves the same thing just for pediatric patients. Next month, I'm actually doing a CPN course, which is a certified pediatric nurse course, so that I can get my certification for that. With general education, there's also emotional criteria that you need to know about that nurses deal with all the time. We deal with stressful situations such as rapid responses and codes and high acuity kids. But we do also deal with happy situations such as our kids being discharged, actually getting to know our patients and their families. During the holidays, at Halloween, we have our child life specialists that actually hand out costumes and let the kids trick-or-treat down the halls on different floors. And then for Christmas, we have donations of toys, and on Christmas Eve, we actually put out the gifts in the patient's room so that they think that Santa came. So it's actually a fun time too. So in conclusion, being a pediatric nurse is a very rewarding career, and if you meet all the criteria, it would be the perfect career for you.